Hi, I'm Marlene Hilton. It's my pleasure to introduce you to ZERONA, a technological innovation that will revolutionize your practice and deliver a proven method to help your patients reduce fat and inches to reveal their true shape, both painlessly and effectively. Do I have your attention? Good. The future of non-invasive medicine is now, and it starts in your office with your new low-level laser equipment, brought to you by Santa Barbara Medical Innovations, or SBMI. SBMI has been committed to enhancing practice profitability using proven, innovative health products that are both safe and effective. So what makes ZERONA revolutionary? ZERONA is a clinically proven, safe and effective, non-invasive alternative to removing excess fat from the body. Using the ZERONA treatment plan and by following the recommended protocol, your patients can experience a remarkable reduction in fat. In clinical trials, patients lost an average of 3.64 inches without any instruction or information of protocol. Those patients in the trials that adhered to ZERONA's easy-to-follow protocol lost up to 7 inches or more in those stubborn trouble areas, such as the tummy, back, hips, thighs, and even arms. In the past, patients could only achieve body slimming results like this through invasive procedures, which many patients are adverse to trying. The ZERONA is applied externally, utilizing the patented and clinically proven Zirconia laser scanner. This allows your patients to achieve desired physical results and remain active both during and after treatment without the risk or downtime associated with surgery. This patented method is what makes ZERONA not only revolutionary, but the only proven non-invasive body slimming procedure to effectively and painlessly remove excess fat. ZERONA will also allow you to revolutionize your practice by attracting new patients and capitalize on the future of non-invasive body slimming, all while providing your patients with an opportunity to enjoy better health and well-being. So how does ZERONA painlessly reduce fat in inches? ZERONA works by using a patented low-level laser that operates at a wavelength of 635 nanometers and emits no heat. Simply put, the laser works by stimulating adipocyte cells and emulsifying the fat within the cell. Once stimulated, a transitory pore is formed and the emulsified triglycerides and fatty acids are released into the interstitial space and pass through the body during its normal course of detoxification. ZERONA not only removes fat in inches from the target areas, this remarkable device has been proven to have a cascading or systemic effect, impacting adjacent cells. It's because of this systemic effect that with ZERONA, patients can expect to lose inches not only in the targeted areas of the waist, hips, and thighs, but in other areas where fat exists, such as the arms, face, and neck. And your patients can achieve this transformation both painlessly and without downtime. How great is that? For more information on the science behind ZERONA and the differences between light therapies, please refer to that portion of the training video. Now that you have a brief overview of ZERONA, feel free to view any of the other videos that will help get you started. Once your ZERONA is properly assembled, it's now time to turn it on and get started. In this video, we'll cover proper machine use, overview of clicks, and proper positioning. The ZERONA is extremely user-friendly and is completely programmed so that it is almost effortless on your part during treatments. Prior to treating your first patient, turn the unit on by placing one of the keys into the key lock and turning it to the on position. This will be just a quarter turn clockwise. The machine will take approximately 30 to 45 seconds to boot up and launch the startup screen. When the machine is ready for use, the touch screen will display the startup screen. Touch anywhere on the Touch Here to Begin bar, which is found across the bottom of the screen. Choose the ZERONA Mode button. Hit the Start button and your patient is ready for their treatment. It's just that easy. Your ZERONA laser comes installed with 206 clicks. These clicks represent 17 patients, or 204 clicks and 2 additional clicks for training. It's important to remember that every time you press the Start button in the ZERONA mode, this will consume 2 clicks. So for example, 1 click for the front and 1 click for the back, with a pause after the first 20 minutes. While in the ZERONA mode, the display will show the clicks remaining in the lower left-hand corner. To order more clicks, please call SBMI Client Services at 866-207-8907. Now that you have your laser powered up and you understand how clicks work, let's discuss the proper positioning of the laser heads. Have your patients wearing their undergarments and safety glasses lie on their backs. Position the laser and arms 6 to 12 inches above the patient, depending on the patient's volume of subcutaneous fat. Using the center diode as your guide, place the center diode slightly below the navel. Now you may adjust the laser arms over the regions requiring cosmetic fat reduction. These diodes should be bent in such a way that the light shines directly on the sides of the body. Make sure that you follow these 3 basic rules. 1. The diodes must never exceed 12 inches above the skin. 2. Adjacently placed laser linear beams must overlap. If you must go over 12 inches, you need to reevaluate your patient's needs. 3. The law of cosine. The laser needs to be perpendicular to the plane of the skin. Once the lasers are in proper positions, all you need to do is hit the Start button. The ZERONA is so convenient and so user-friendly because it's already pre-programmed with treatment times and frequencies. Once you hit the Start button, simply leave the room and return to other patients' needs. When the first 20 minutes are up, the lasers will turn off and a high-pitched beep will emit from the machine. Return to the room and have the patient turn over onto their stomach. Once again, using the center diode, position the laser no more than 12 inches above the skin and centered where the navel would be. Reposition the laser arms over treatment areas. Hit the Start button and you are once again free to leave the room. After the second 20-minute posterior treatment, the laser will automatically turn off and alert you with the high-pitched beep. The patient can get dressed, leave the office, and resume their daily lives. It's just that simple.